Bell, Ribeiro-Addy, and can I just remind you that we need to go to front bench speeches at 4:24. Thank you.
Thank you very much, Mrs. Millen. It's a pleasure to serve under your chairship. I'm going to start by congratulating my friend, the Honourable Member for Wolverhampton South East, for securing this debate and for his sterling work as the chair of the APPG on sickle cell and thalassemia. And also commend my friend and neighbour, the Honourable Member for Vauxhall. She always speaks with such affection about her mother, and I hope she knows that her mum would be so incredibly proud of her if she was alive today. Now, the landmark report from the APPG, which was triggered by the tragic and unavoidable death of Evan Nathan Smith in North Middlesex Hospital, reveals the terrible truth of sickle cell treatment, the substandard care, the stigmatisation and the lack of prioritisation of this condition. So I was pleased myself as an officer of the group that the report came forward, but also to be able to give evidence as somebody who cared for somebody with sickle cell, someone who lost a loved one, my friend Adjoa, to negligent care. I sat with her in many hospital admissions, and I witnessed mistakes, I witnessed mistreatment. And, you know, she said to me on more than one occasion, one day this hospital is going to kill me, and one day they actually did. So I hope that the Minister has read this report and taken into account the many recommendations and will hopefully outline today what the steps the government will be taking to improve the treatment of sickle cell as a condition and the experience of sickle cell patients within our National Health Service overall. I also hope that the Minister will touch on what steps the government will be taking to specifically improve the treatment of black sickle cell patients, because unfortunately for those of African and Caribbean heritage, the experience of sickle cell is made far worse due to the prevalence of institutional racism. Now, we've heard in several past debates and through various inquiries, reports and personal accounts how racist attitudes can negatively impact a patient's healthcare and experience, from a lack of research, certainly on sickle cell, that's a major issue, bias perceptions of pain tolerance, drug habits and medical knowledge, as well as experiences of overt racism, all of which come together to make the experience of living with any condition difficult, but living with sickle cell even harder. And I would just like to say, whenever we talk about institutional racism in the NHS, sometimes we are met from members opposite saying, you know, why are you calling our NHS staff racist? We're not calling NHS staff racist. We value our NHS staff. We are just recognising that the institution of the NHS, which is governed by the government, has issues when it comes to race, and that the policies and practices create biases which cause us problems. We want to know what the government is doing about it. Now, sickle cell is often referred to as an invisible illness because of the pain and how it's experienced, and often it's invisible to others. But there's also a really distinct lack of education and public awareness of the condition and the symptoms. And I point specifically to the issue of education, because I studied biomedical sciences and specialised in cellular pathology as an undergraduate degree, and I was quite struck because of the amount I knew about sickle cell before I went to university, just how much it was used as an example, but just how little those teaching me knew about the practical aspects of it. And I think if we don't improve education of those that treat people, we are never going to improve the outcomes. So that definitely needs to be looked at. Now, the recent removal of discriminatory blood donation restrictions on black donors was really a massive step in the right direction, and I really welcome this announcement. The largest beneficiaries of this change will be those patients who are often treated through blood transfusions and need rare blood subgroups, such as RO, that are more common in black people. I have this blood group, and so I give blood, and I ask for all people from the black community, and actually all communities. Blood donations have gone down so rapidly during the pandemic. They're needed no less at the moment, and I encourage everybody to give blood. And I would love to see a blood donation stand in Parliament one day. There's so many of us here, and we should all be able to roll up our sleeves and give a pint or two. Yes, I will do.
Shannon.
I think the government has been very keen to have blood donations, and the Honourable Lady has very kindly volunteered and says she's been doing it. I think she should be perhaps a poster lady for the campaign, and maybe the Minister would take that on board.
I thank the Honourable Member for his contribution and look forward to seeing him roll up his sleeve as well. Now, maintaining those discriminatory blood donation rules for so long was really poor because it was based on outdated HIV science, and it denied thousands of black sickle cell patients the treatment that they needed. And not only that, the legacy of these rules resulted in a reluctance amongst the black community to come forward and donate blood, and these restrictions have resulted in a shortage of black blood donors and have a severe effect on the willingness of the black community to donate overall. So we have to work to undo that damage. And I'm calling on the Minister today to make a promise to all of us here and those who are keenly watching this debate to ensure that the government will act to improve the quality of care and treatment of sickle cell patients. Words are good, but action is better. And my honourable friend touched on the issue of prescriptions and just how much of a barrier that is to receiving proper care. We want to see actions such as that. Those watching at home are doing so in eager anticipation of something that will give them hope of a better treatment, and I sincerely hope that the Minister won't let them down today. Thank you.